Hi guys, today let's talk depression. I am going to start with a quote by the famous American president Abraham Lincoln, who said, "I am now the most miserable man living. If what I feel were equally distributed to the whole human family, there will be not one cheerful face on earth. Whether I shall ever be better, I cannot tell. I awfully forebode I shall not. To remain as I am is impossible. I must die or be better, it appears to me." Abraham Lincoln, the person who painted him when he arrived at the White House, describes that he had never seen a more sadder individual in his life. So you can imagine how challenging depression is. What is depression? It is a medical condition characterized by extreme sadness and dejection. Depression is not just a feeling of sadness that we all experience sometimes, which is normal for most people to feel sad at times, particularly when we're faced with losses or feelings of grief. Clinical depression, on the other hand, is so much more than a low mood or a feeling of sadness. It is a serious medical illness that causes both physical and psychological debilitating symptoms. If left untreated, depression can lead to serious health complications, including putting your life at risk. Fortunately, once diagnosed, depression definitely can be treated using a range of effective and safe approaches through options like therapy, medication, diet, and even exercise. Despite the seriousness of depression as a disease and the availability of effective treatment, only 30% of cases worldwide receive appropriate care. Depression also can mask itself as a physical illness, such as chronic pain, sleeplessness, or fatigue. Therefore, many people who suffer from depression are not treated for years, and they suffer for years from what is a treatable condition. Despite this being a common illness, the stigma we know attached to depression prejudices the public against people with depression. For this reason, large numbers don't seek help for treatment. According to the WHO, the World Health Organization, depression is set to become, and has probably already become, the second largest cause of suffering next to heart disease. So what is depression? Let's go through a quick checklist. It's a common mental disorder characterized by depressed mood, loss of interest and pleasure, loss of energy and decreased activity. We experience poor concentration, poor self-esteem and confidence. We feel guilty and unworthy. We have pessimistic thoughts, and we also think of self-harm. Our appetite decreases. We struggle to sleep or wake up early. We feel restless or agitated. And sadly, we also feel that life is not worth living. These symptoms can be intense, prolonged, and can interfere with our daily activities. And these features differentiate depression from normal sadness. These problems can be chronic or recurrent, substantially impair our ability to cope with daily life. At its worst, this can lead to suicide and a tragic fatality associated with the loss of about 850,000 lives a year. Though depression is primarily a psychological illness, bodily symptoms are very common with depressed patients. Very often, patients will describe headaches, generalized aches and pains, and symptoms affecting multiple organs are common complaints. Bodily symptoms, in fact, may present as the first complaint rather than depression symptoms. And these can influence the patient in terms of mentally and emotionally. Vast majority of patients will also describe disturbed sleep, dreams, nightmares, a lack of freshness in the morning. Sometimes, interestingly, patients will describe sleeping excessively. They'll describe a loss of appetite, and weight loss is described by a large number of patients. Our thoughts literally become slow, and even our actions also become slow. There's a lack of spontaneous movement. We sit slumped, downcast gaze, feeling fatigue, reduced speech, and we take more time to respond. Women will even describe irregularities of the menstrual cycle combined with the symptoms above that we spoke of. Depression at times can be masked by the use of alcohol and drug problems. People will take refuge, be it in alcohol, tobacco, or any of the vices to escape the depressed mood. So, what causes this depression? It can be a whole host of physical, psychological, and in fact chemical factors that affect the brain. Physical factors will include medical illness and its treatment sometimes, inherited traits, chemical changes, and drug and alcohol use. Psychological factors are life stresses, negative experiences, and high anxiety. Who then is at risk for getting depression? Women are at a greater risk than men. Separated and divorced obviously adds as well. A person without close family members or having a close family is more so affected. Those also have close family members or with depression are more likely as well to suffer from depression. Early parental loss is also a factor. Negative stressful events and chronic stress. Lack of social support. Living in urban rather than rural areas. It's all very well that you may experience these symptoms, but it's also very important that you get this professionally diagnosed by a medical practitioner. And the medical doctor or healthcare worker will go through these symptoms with the patient, be it through assessments or clinically assess the patient. If you or anyone knows may be suffering with this, please don't ignore these feelings. It's important to reach out to family members and give them the help they need, that they get to a medical professional. There are many places where nowadays you can get help, and there are many people who need help. While it may not feel obvious, and you might not even believe in it, there are treatments available. So don't give up on yourself. So what kind of treatments are there? In every case of depression, there's a need for careful medical and psychological assessment, and people experience their depression in various ways. So there's no right way or wrong way on how to experience depression. And you'll find each case varies from person to person and from case to case. In cases of depression, there's a whole range of interventions. First, generally among psychiatrists will be specific drug medication and therapy, education to facilitate better understanding of the illness, and also psychological therapy. It's not a guarantee though that you have to take drugs. Yes, psychological intervention can help, and if that is effective, you can continue with that. Medication is where it feels that it cannot be dealt with just at a psychological level. The common drug therapy we use is antidepressants, which impacts on the chemical messenger systems in the brain. This helps improves your sleep, concentration, energy, and in fact contributes to a better mood and less anxiety. Medically prescribed antidepressants, we have to iterate, are not addictive and are relatively safe to be taken for a long period of time. Generally, medication may be taken for 3 to 6 months, is considered essential for relief of symptoms. Depending on the nature of the illness, the patient may be advised to continue even longer. There are a range of psychological therapies for helping patients aimed at reducing your depression and reducing anxiety. Also very important is to stop drug and alcohol use and resolve life stresses, and also learn better coping skills. So a lot of education and counseling helps the patient. Also, you and I need to learn to reduce stress generally, resolve conflicts, learn to manage life better, develop new ways of thinking about yourself and the world, and develop new ways of enjoying activities. Part of the treatment may help the patient avoid family conflicts and develop ways of using the family as a means of support. Yes, there are other ways that can be considered. Yoga, meditation, exercise, which we spoke of, naturopathy, may all be advised as supportive measures. Please though, whatever measures you consider, speak to your doctor and they will help you. Your medical practitioner will look at the various accessory treatments if they are appropriate for you as well, and the doctor will come up with an appropriate plan, drawing on their expertise and other health professionals' expertise. So that can allow you to get to a normal state of activity. Remember, depression is a treatable condition with a combination of therapies. So let us talk more about mental health so those amongst us who need the support can seek treatment. Seek out help is the first step to a road to treatment through medication and talk therapy. Depression is a mental health illness. Open discussions about mental health will make us feel comfortable about ourselves and thereby reduce the stigma attached to mental health. So recognize there's always help for depression. Go and speak to some professional. They will assist you. There's always a way forward. So till next time, subscribe and we'll chat again. Bye.